All right, so we are in the last chapter of Module 11. We are the last chapter of Module 11, which is Chapter 38, Disorientation, Delirium, and Dementia. So we will identify in this chapter the age-related brain changes of disorientation and delirium, dementia, the types of dementia in the stages, and of course, how can we support them in caregiving process, right? So first, age-related brain changes. Normal aging causes structural and functional brain changes. The confusion, the delirium, dementia is not part of the normal aging, right? Those are considered symptoms or illnesses or related to existing disease that the client is experiencing. It's not a normal process, okay? They might experience confusion, delirium, dementia because certain disease accelerate the cognitive decline of the individual. All right. So when we talk about disorientation, it's also called confusion. It is impaired recall of people, time, or place, usually linked to an underlying medical condition. When we say underlying to a medical condition, it could be the person experiencing disorientation because of something, right? Of some illnesses that he or she's experiencing. Signs and symptoms, it could have some behavioral changes like anger, restlessness, and irritability. There could be some hallucinations and delusions as well. There might be some decline in level of consciousness, and of course, disorganized thinking and attention problems for disorientation. Mostly, the common causes of disorientation is like if the client has UTI, especially for older adults. There might be some electrolyte imbalance or low blood sugar. So if they haven't eaten yet, so that's why it's very important that they need to eat. What else? Of course, medication that they're taking. They might be sleep deprived. They might have fever or head injury, right? So those are some common causes of disorientation. Next, delirium. When we talk about delirium, it's an acute, sudden onset of mental confusion. It's a medical emergency. It's often reversible if treated immediately. So the signs and symptoms of delirium, it could be a disturbed attention and concentration, so the client can't focus. They are so preoccupied with certain things that we don't actually know what. There might be some fluctuating level of alertness. They might be alert for a few minutes and then they go down, alert and go down, right? So that's fluctuation. It could also be hallucination and altered perception. They might see things or hear things that we cannot see and hear, and also disorientation to time and place. So they don't know what the time now or they don't know where they are at the moment. So the cause and treatment. So it could be delirium. It's due to infection. The client might be dehydrated or some medication that they're taking, right? Poor nutrition or emotional trauma. That's also one of the causes. And make sure treatment focus on identifying and reversing the cause. So let's say, for example, if the cause of the delirium is dehydration, then we need to hydrate them. If the cause of infection, then we need to treat the infection or kill the infection, right? So depends. Next will be dementia. When we talk about dementia, it is a progressive loss of cognitive and social functions of an individual. It actually interferes with the daily living activities of that person. And again, dementia, it's not a normal part of aging process, okay? It's not a normal part of aging process. So, early warning signs of dementia, recent memory loss, difficulty performing familiar tasks, and of course, language problems and personality changes, right? So, those are some of the early warning signs. We have different types of dementia or illnesses that has dementia symptoms, Alzheimer's disease, vascular dementia, dementia with Lewy bodies, or the frontotemporal dementia. So those are some of the types of dementia. Again, you can read those and search for those types of dementia. I'm not going to go through with them one by one. That's your part to do it and read about them. And the stages of dementia is early stage, mild stage, or the moderate stage, and the late stage. So early, it could be like mild symptoms of forgetfulness and all that stuff. In the middle, it's gonna get a little bit worse, gonna get serious in terms of like forgetfulness and all that stuff. And of course, the late stage, it's the severe one. So they can't remember anything anymore, right? So that's the severe or the late stage dementia. So how you support clients with dementia? Make sure we meet the basic and physical and emotional needs of the person. Make sure when you are taking care of them, make sure you maintain the safety, and it should always be a structured routine. So what you do today for him should always be the same as what you will do the next day and the following days. It should always be a routine, right? And of course, encourage them for meaningful activities like spending time with their families, with their loved ones, going out for a walk with you or whoever, right? So that's actually encouraging them for meaningful activities. In terms of managing responsive behaviors, always remember that if they've done something a little bit foul, or like they said bad words about you, make sure that it's not personal, right? Just always remember that they've done some things because they are going through some illnesses, behavior illnesses, right? So make sure that you need to empathize them and validate their techniques. Don't take things personally. For for caregiver needs, make sure that caregiver should have emotional and physical demands, because again, have a strong personality, because again, it has emotional and physical demand. So you need to be very strong enough to accept or to take care of clients with dementia, because it deals with behavior, right? Support groups and respite care are also essential in terms of giving care for those clients, and making sure that caregivers, whether it's the PSW or the family member, they are always part of the healthcare team. So references, if you want to read further about it, you can always go to chapter 38, read the Disorientation, Delirium, Dementia, and it's always in the PSW Foundation, right? So that's it. And if you guys have more questions with regards to it, we will discuss that after this lecture, okay? So good luck and see you in the next module.